Welcome, everybody, to the Code of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I have an interesting one for you today. I am learning about fecal transplants. I'm not kidding. This is something that I've been reading more about. There's a lot of research about the microbiome and GI gut health, and I have been hearing from people that I really, really respect. One of my best friends in veterinary medicine, a practitioner on the West Coast, is doing a ton of fecal transplants and talking a lot about it. And I was just like, this is not in my game. And so I want to understand this to the point that I am capable of doing this procedure. And so that's what we got into today. Guys, I got Dr. James Oldeschulte, and he is here walking me through. We do a case. We work with a 7-year-old Chihuahua that's a happy dog, but got diarrhea. And he's talking about using fecal transplant on emergency, right? Like acute diarrhea. And I was shocked. I thought it was a chronic GI problem thing. That's what I thought we were doing with this. But no, it's not. And anyway, it's a great episode. I think you guys will enjoy it. I got a ton out of it. I made a couple pages of notes. This is a good one. Guys, this episode is made possible by Amend Pet. Poop donor to dose. FMT made easy. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. James Oldeschulte. How are you, my friend?
Doing awesome. Glad to be here.
I am glad to have you here. I have some stuff I want to talk to you about. For those who do not know you, I love this. You are the director of new ER doctors at VEG, or you call it nerd, new ER doctors, like the nerd squad. I think that's hilarious. That's my dad joke, a sense of humor right on the button. But yeah, you're the director of new ER doctors at VEG. You have been a medical director at a fairly large veterinary practice in the past. You yourself are a doctor and practicing. And you are doing a lot with fecal transplants. And fecal transplants, or fecal microbiota transplants, FMTs, this is an approach to medicine that I'm hearing more and more about. I heard years ago about fecal transplants, and I kind of said, well, we'll see about that. And as the microbiome is getting more and more attention, we're seeing microbiome diets, we're seeing probiotics and prebiotics, and all of these sorts of things around gut health and gut flora. The idea of fecal transplants is definitely sort of gaining traction, and there's more and more research that's supporting the efficacy of this. That said, I've not done this. I have not seen this with my own eyes. I've read about this, and it's something that I want to know more about. And you're an ER doctor, and this is a tool in your tool belt. And so I have a case that I wanted to bring to you, and I wanted to talk to you about how you would actually use fecal transplants in a case of diarrhea. Is that okay?
Sounds right up my alley. Huge fan. So
all right.
Yeah.
Outstanding. All right. So here, I'm just going to set the scene, and then I have questions, but I'm going to try to sit on my hands and let you tell me about this case. So, all right. I have a 7-year-old female spayed Chihuahua named Penny. Penny is in, same day appointment. They wanted to get right in. She is in for acute diarrhea. It's not bloody. It's mucousy. And according to mom and dad, it's everywhere. Like, she is having real issues. And she's Chihuahua, so I'm sure it's probably not that big a volume, but they believe it's a lot. I'm not going to argue with them. I'm going to take them at their word. Anyway, Penny's got acute diarrhea all over the place. Now, here's the thing. Penny's coming in. She is not vomiting. She does not have a painful abdomen. I talked to the owners. They had some friends over last night. There was some carousing. They had dinner together. Mom doesn't know if Penny is just stressed or if people at dinner last night were feeding Penny things that she should not have had. But either way, there's no foreign body obstruction here. I don't think she's got pancreatitis. I don't have anything to support that. I'm just looking at a fairly happy acute diarrhea dog. And what popped into my head was, I heard someone say that fecal transplants in acute diarrhea dogs are a thing. And I thought, that's hard to get my head around. And so I'm going to stop talking now. James, walk me through this. How do you treat this case?
Absolutely. I think this is an ER classic. Acute diarrhea comes in. The biggest thing to me that the pet parent is always looking for is they want that poop better as quickly as possible. Yes. I have a bunch of tests and things that I can do. All of those things are great. Absolutely. And they're looking for the actual treatments that'll make Penny feel better and keep the rugs clean. keep the poop off the rugs.
Yes.
So with that
Yes.
in mind,
They want results.
yeah, exactly. So I have been a huge fan of psyllium fiber and fecal transplants for a long time. And within the past year, there are new consortium guidelines, a group of international GI experts who have said this should be a first-line recommendation for acute diarrhea in dogs, which is mind-blowing.
Well, how long have you been doing this for?
Okay, so weirdly, I've been doing it for about 5 years because I had a colleague who just loved doing fecal transplants in Parvo puppies. And I say weirdly because I don't think it was all that mainstream 5 years ago. Correct me if I'm wrong. And there's been some evidence. Yeah, for Parvo, for chronic enteropathies, there's definitely been some evidence that we could do fecal transplant and make a positive impact on the GI flora. And I still love it for those things, still use it for Parvo. But the real bread and butter of emergency, what we see every day is acute diarrhea. And I think when we see acute diarrhea, the customers want to know that their dogs are healthy, but many of these dogs come in wagging their tail, looking bright, looking alert, just like you're describing with Penny here. And what I feel, my job is to make the diarrhea better as fast as possible, restore the gut microbiome.
When I was thinking about fecal transplants, and the first time I was sort of learning about it and reading about it, chronic diarrhea cases made sense to me. I'm like, wait, when I've got a dog and they continuously have these problems, or maybe they continue to have stress colitis, or this is a dog that's been on antibiotics and I suspect the microbiome has been knocked down or affected negatively. Like those types of ongoing illnesses, that was the thing that I thought, okay, this is obviously what this is used for. The idea of going to this in an emergency case, again, it was just not something that sort of occurred to me. So walk me through this. You and I are going to walk out of the doctor's office. We're going to head back to the treatment room. Walk me through the process for those of us who are not familiar with sort of what a fecal transplant looks like in practice.
Yeah, so I do try to bring it up early with the pet parents, and you'd be surprised how many of them have heard of it. I practice here in Austin, but also just with this becoming more common, many of them have already heard of a fecal transplant as a thing. So it's not that foreign to them. And we have capsules, stock and ready, that have healthy screened donor poop ready to go for the dogs that need it with diarrhea. So we have these waiting in our freezer ready to go.
Are you serious? So granted, now you are in Austin, and like the last time I was there were big signs that said "Keep Austin Weird." I don't know if Greenville, South Carolina pet owners are like, yes, I'm up to speed on this. Do you think that they are? Do you really think that this is a thing that pet owners are sort of attuned to?
I was talking about FMT at IVEX 2024, and I was getting my hair cut, talking to the woman who cuts my hair, and she said, What are you up to today? I was like, I'm working on this talk. It's about fiber and fecal transplant. And as soon as I said it, I was like, why would I tell her that, And
yeah.
She was like,
she withdrew her fingers from your hair.
Yeah.
And no.
She was like, oh yeah, I heard about that on Grey's Anatomy 10 years ago. And I was like, not that weird. So I think already with the group that I'm with, Veg, we are doing this at sites across the country. Certainly do a lot of it in Austin. There's big emphasis here on health, antibiotic stewardship, and that's something that pet parents now expect is antibiotic stewardship from their doctors and their veterinarians. But yeah, I know that there are some doing it in the Carolinas. I know it's out there.
That makes sense. What are the most common questions the pet owners have when you say, this is what I would like to do? How do they respond? I can imagine if someone walked in and I said, my dog has diarrhea, and he said, we're going to do a fecal transplant. The first time I heard that, I would wonder how that worked. I don't know what I would say. How do they respond?
It's like anything else. They want to know how we're going to do it. And, before I had these capsules, I was doing it as a per rectum enema, which I really tried to emphasize. It's not that difficult or messy or hard to do it that way. The capsules are an absolute game changer because what I describe is we have these pills. They're just pills of healthy dog poop.
Yep.
And for the next couple of days, just a couple of days, you're going to give your dog some of these pills 2 to 3 times a day. It's really easy. Most dogs will just eat them if you put them on the food. If we make it easy and accessible, I think it's easy and accessible. If we normalize it to these folks, like they want all of the things. They want all of the tools that are in your toolkit when they're treating their dog's diarrhea. So I think it's on us to make it easy and accessible to them.
I'm assuming you're just up front of like, this is a pill. It goes in the mouth. That's the end that it goes in. I mean, if I said a fecal transplant, I worry that pet owners would immediately have other ideas about where they would be working.
Yep, I agree. I do say this is a pill that goes in the mouth. A lot of times we have one of our donor dogs there because we have 5 screens donors in the hospital. We have this big, beautiful Pyrenees. We're an open concept ER hospital. So you can just be like, that's Coda. He's our screened donor right there. So it's sort of like farm to table. They know the source. They see the source right there. Sometimes we joke about it. and it's usually well received.
I can imagine. It's hard not to.
Yeah.
It's hard not to. So, okay, so talk to me about screening here. So the first step, in sort of doing fecal transplants is testing and screening. Walk me through that. Walk me through that, because a lot of people are going to be saying, like, what am I looking for? And what is good feces? What constitutes good feces? And so talk to me about testing process.
I think in the interest of keeping it easy and accessible, I'll admit that when I started doing this, per rectum enemas, wasn't doing a lot of screening. We know who our healthy poopers are. Hopefully, as veterinarians, we're screening our own dogs for intestinal parasites. And for those patients early, I wasn't doing a whole lot of screening. Luckily, the consortium guidelines and Texas A&M GI Lab, they've published on how to do this and how to screen these donors. So I try to follow their guidelines. And in our hospital, what we do is we do the dysbiosis index. The group AmendPet that helps make the capsules, they do a great job providing that test and interpreting those results for us. So they help with the donor screening on that end. And then we just make sure they're on monthly prevention and that there aren't any intestinal parasites or Giardia in there. There are a couple other things mentioned in the consortium guidelines, like these shouldn't be dogs that are having bouts of diarrhea or dogs that have been on antibiotics in the past 6 months. But having that dysbiosis index, that test from Texas A&M, that's the one that shows, hey, like these are the healthy poopers with the healthy guys in their gut that we want to pass on to the diseased guys.
Does that tend to change? Like, I mean, there are dogs that seem to be, I don't know, I'm sort of using the term healthy pooper now, but if there seem to be dogs that are fine until they're not fine. Is this something that you kind of check on the regular?
Every 6 months, we try to make sure.
Okay.
Yeah. There's a real easy way, I think, with the device that we're using now, where they send us a little vial, we send some poop to A&M, we get a report back, and we just make sure that all of the major players of good gut health are hanging out there ready to go and save the next dog from diarrhea.
So yeah, you mentioned AmendPet, and so my understanding is that they've got kind of a device that just makes capsule making pretty easy, and a test kit, like they'll collect your sample and everything like that, and it seems like you back it up and send it out, and you get your dysbiosis index back. Is that correct?
Correct. Yeah. So I have no actual connection to AmendPet, but the joy for me has been, this is something that I used to be passionate about, that I would do like occasionally. And as those consortium guidelines came out recommending it for acute diarrhea, and I started recommending more, the joy is that by the numbers, all of the sudden we're doing, I think it's about 15 times as many fecal transplants as we were doing before. So I know in the hospital I'm at here in Austin, we've done about 160 in the past 6 months.
Okay, so talk to me a little bit about, you've got your screening test done. You've got your donors that your clinic knows. You're like, yep, these are our donors. They're solid. They have the microbiota that we want to sort of pass on. Walk me from I have the dog that's screened to here's the capsule that I'm sending home.
For the first batches, I did a lot of them myself. It's pretty quick and easy, but basically you have a tabletop mixer. It's almost like a little size of a tabletop centrifuge that we would have. And you have a sealed canister. So I would take one healthy Great Pyrenees poop, and I would put it in the sealed canister, and I'd mix it into a slurry with a bit of glycerol. And then the device, you rotate it one way, you rotate it another way, and it just fills up a set of capsules in a capsule ring. These are used in human studies as well, so I'd say the device does a really good job keeping everything clean when it makes those pills, and then you just cap your pills, put them in the freezer. And for us, we've never had to worry about how long they last. Usually we're making a batch every couple of weeks, but they will last, I'd heard, up to 6 months with the glycerol in there. So we always have it ready. The other joy for me as someone who likes the slurry, the enema option, especially for hospitalized severe diarrhea cases or Parvo cases, is that we are using the same device. We're making some slurry, and then I have a 60cc syringe of fecal slurry ready to go for a fecal transplant in hospital, which has made it a lot easier for those Parvo pups that we're trying to get a fecal enema to.
Do you choose the enema over the capsules? Like when you have something like Parvo, when you have vomiting or things like that, is that sort of the defining factor of when you would do an enema instead of going capsules?
If the dog's not eating and it's hospitalized, I think an enema is a great option. So if the dog's not eating and it's hospitalized, definitely have had Parvo puppies where, especially now with the canine Parvo monoclonal antibody and everything we do, I've seen some of those dogs bounce back so quickly they're out of the hospital the next day. And then we'll send home some capsules, some FMT capsules to help their gut flora out.
Talk to me how you do dosing on this. We got Penny here, right? And she's a Chihuahua, so it's a small dog. Is she like, how would you dose that dog? What's the general dosing schedule, I guess?
Yeah, so usually it's about 0.5 grams per kilogram of feces. And the capsules
Okay.
are zero point 0.4 grams per capsule. So we have, like many hospitals do, a little calculator spreadsheet shared among the doctors, and we'll just punch in the weight and see how many capsules we need. For Penny, I'd just guess for Chihuahua-sized dog, it's usually like 8 to 10 caps. That's it. So it's not very many capsules that Penny's going to take. And when you think about the amount that we're making, sometimes a couple hundred, even a few hundred from a single round of the Great Pyrenees, that means that we're not using very many of those caps for Penny. For larger dogs.
Oh, so you said 8 to 10, and you said that's not many caps. It's like, it seems like it's a lot at one time.
It's a lot at one time. If I could get them to take them all at once, it might work. Usually I split it over at least the first 2 days. So I'll say just give 2 capsules 2 to 3 times a day. Interestingly, in one of the big human studies, they're just trying to get the capsules in the human as quickly as possible. So sometimes they'll just have them take all 30 at once or take 15 and 15. From the human studies that are maxing out at 30, we used to, even in big dogs, send them home with like 80 capsules. But we follow up with all of the patients we're doing this with. And what I found was usually you send home 80 capsules of anything. It doesn't matter what it is. You're not going to get 80 capsules into that animal, especially if that animal's feeling better and all that. So we've started maxing out at 30.
They're going to figure it out at some point.
Yeah.
Like you can fool a lab a lot, but at some point he's going to catch on to what you're doing.
Yeah. So we max out. We just say, hey, big dogs, 30 caps, get them in over the first 2 days.
Okay. Honestly, 80 was the number like in my head. I was like, you got a 40-kilo, Labrador. That's 80 capsules. And so it's funny you said that, because that was exactly what I was thinking. I was like, boy, that's a lot to get into a dog, especially if you're trying to do it fairly quickly. It definitely makes sense you spreading out over 2 days or so. I go, okay, that definitely makes some sense. Okay. But what you do now is big dogs, you just cap it at about 30?
Cap it at 30.
Talk to me about efficacy here, right? So I'm doing this, Penny comes in, we're like, hey, we're gonna send you home with some fiber supplements, and here's, these 8 to 10 caps. I know that this person made a same-day appointment to get in and have their dog seen for diarrhea. She's going to say, how long is this going to take? I mean, what kind of guidance do you give? What do you expect as far as efficacy?
Yeah, I think usually I'll tell people, I hope your dog's diarrhea is better by tomorrow. I always give the caveat, sometimes it's 2 to 4 days before it's better, but it should at least be improving. We're almost always giving psyllium fiber as well, which the joy of psyllium is that it really gels up the poop. When they're eating and taking that, great, get them some psyllium fiber as well. And often they're better by the next day. But that's why they came in. They want the diarrhea better.
I think this was a chronic diarrhea dog. Do you approach treatment differently, or is sort of what you're going to go for with acute diarrhea and what you're going to do for sort of a chronic patient, are they the same?
Absolutely. I mean, I think there are some great sort of stepwise therapeutic things we can do for chronic diarrhea dogs. Certainly, as an ER vet, I don't get as much opportunity to treat those patients over several visits, but I just had a friend call me up actually about a chronic diarrhea dog, and they were located several states away, and they knew that I had been making these FMT capsules and they wanted to try it. So we shipped some capsules to them to try for the chronic diarrhea. This is something that there's a lot of evidence for chronic diarrhea in trying the fecal transplant on those dogs. So I think the difference to me is with acute diarrhea, it's usually a one-shot deal. We're doing it once, the dog gets better, great. But for those chronic diarrhea patients, what I prep them for is sometimes it does take multiple treatments, and don't give up if it doesn't work after the first treatment. We're trying to change a rainforest here. There's a whole ecosystem of things going on, and we're trying to make this change. So we'll do a treatment course, and then even 3 weeks later, do another treatment course and see how it goes. So when I sent those capsules, I actually sent enough for 3 treatment courses so they could repeat it.
Gotcha. Yeah, I've heard that like a maintenance regime is a way that you can sort of approach some of the chronic cases. That sort of makes sense to me. When you send multiple courses, how far do you spread them apart? Is it like once a month? Is it once a quarter? Like just once a year? What's there the ballpark range? Or is it as needed? Is it like, hey, wait, and if you start to see these changes in stool quality, then you're going to go ahead and start your second
Certainly,
course?
If there's a flare, I think it's the first thing I'd do. But otherwise, what I've heard is that, every 2 to 4 weeks, doing another repeat course of it. Especially for those dogs that have really struggled with chronic intermittent diarrhea and loose stools.
Talk to me about treatment at home. So we send these home, things like that. I mean, is there any sort of maintenance or prep that they need? I'm assuming they sort of just store the capsules in the freezer, or
They store them in the freezer.
yeah.
We don't even send home rubber gloves or anything with them anymore. We found that, people don't usually mind. We just say like, hey, there's poop in these, wash your hands. But yeah, so the one recent story I had, because we are following up and calling these folks, one of our nurses calls and follows up, and she told me this afterwards. The pet parent had been splitting open the capsules to put them on the food because that's what they're used to with the probiotic. So
Sure.
they thought, I'll split open the capsule. So she said, not again.
Please don't. Yeah, please don't. All right. When you see, veterinarians starting to use the therapy, are there any absolute best practices that are not obvious to people? I mean, are there pitfalls, I guess, that you see clinicians making when they're starting the therapy?
I think one of the biggest pitfall is not offering something that now has abundant evidence to support and consortium guidelines that are saying we should recommend this as a first line. I think the joy of FNT is that, especially once you've got screen's donor population and you've got capsules, this is like a quick, easy option. As we're seeing, I'd say, more and more shift away from antibiotics here. This is a happy, healthy alternative.
So, James, we were talking about this. How do you usually do pricing for a therapy like this? Is this an expensive therapy for pet owners? I'm not asking you to give me a dollar value or anything, but just, I guess, relative to other therapies. Like, yeah.
Good question. I think for the value, we've had no pushback on this price-wise in Austin. The range that I've seen is like $100 to $300, and we're right smack dab in the middle of that on ER. But I think the thing on the pricing too is that the cost to make these capsules, keep in mind where they're coming from here. It's the cost per regimen's about $20 to the hospital. So you can price them wherever you want if you want to make this something available to your patients.
That makes sense. Well, it seems like it'll be fairly flexible pricing, but that definitely helps me make some sense. Man, James, this has been fantastic. I really appreciate you taking time and walking through this with me. Well, if people are interested in learning more about fecal transplants, where can they learn more online? What resources do you recommend?
Yeah, I think the new consortium guidelines on fecal transplants, that would definitely be something worth checking out. Not as widely read as it could be, and a really good stepwise approach to how to actually do this for your patients. So that would be great. The Texas A&M MGI lab absolutely has some good resources on the dysbiosis index, which is now recommended in those consortium guidelines. And then look towards Amend Pet if you're interested in this device to help make it quick and easy.
Yeah, I'll link up all that stuff in the show notes. That's fantastic. James, where can people find you online?
I do have a website. I have a very small online presence, not much out there right now. I'm mostly at the hospital and teaching and coaching and growing new ER doctors. So
outstanding. People will look for you leading the nerd squad at Veg. That's outstanding. Awesome. Thanks for being here. Guys, thanks for tuning in, everybody. Take care of yourselves, gang.
Awesome. Thank you.
And that's what I got. Guys, I hope you enjoyed that. I hope you got a lot out of it. I don't get to do a lot of podcasts just talking about poop, but here we are. So anyway, this is fascinating. I am really interested in this, sort of the whole gut health microbiome. Antibiotic alternative for diarrhea obviously is important. I like this episode a lot. I took a lot away from it. I hope you guys did as well. Thanks to Amend Pet for making this episode possible. Guys, take care of yourselves. I'll talk to you later on.